The Complex Realities of Sexual Dysfunction and How to Navigate Them by Professor Nigel MacLennan. What is sexual dysfunction? What impact does sexual dysfunction have on the quality of intimate relationships? What are the myriad of causes of sexual dysfunction? What can you do to avoid sexual dysfunction? If sexual dysfunction does have an impact on you, what can you do about it? If nothing can be done about sexual dysfunction, what are the most effective coping strategies to deal with it? Many people think that sexual dysfunction refers to a persistent or recurrent difficulty experiencing sexual arousal or satisfaction, that a person is unable to perform or enjoy sex. Sex addicts are able and willing to have sex vast numbers of times a day or a week, and enjoy each time, and enjoy it so much that they want more and more and more. Their form of sexual dysfunction, as with all addictions, is that their lives are controlled and dominated by the focus of their addiction, their sexual desire. Too much sex, hypersexuality, can be as dysfunctional as too little sex, hyposexuality. Reasonable estimates of the incidence of sex addiction range from 6% to 8% of the adult population. Like all addictions, recovery rates are low and usually short-lived, and the best treatment is to prevent it turning into a full-blown addiction. At the opposite end of the sexual dysfunction scale is asexuality. Asexuals have little or no sexual attraction to others. There are no reliable figures for the precise numbers of people who are asexual. The well-informed estimates range from 0.5% to 2% of the adult population. As with all forms of sexuality and sexual dysfunction, there are many subgroups and even smaller microgroups within each subgroup. Most forms of sexual dysfunction are exhibited across multiple different continua. They, therefore, have a wide range of impacts on relationships. Here are the general impacts. What is the impact of sexual dysfunction on intimate relationships? Sexual dysfunction of all kinds, we will explore more types next, can put a significant strain on intimate relationships, or indeed render a person unable to form intimate relationships. When sexual intimacy is disrupted for any reason, it can create a distance between partners, thus weakening their emotional connection. The disrupted bond can then make sexual dysfunction even more likely. Difficulties with sexual function can also lead to communication problems, frustration, and even resentment between partners. As the communication problems build, so too does the sexual dysfunction. Both parties may experience reduced confidence in their sexual abilities, which in turn can damage their overall well-being. The emotional and mental damage caused by sexual dysfunction can strain relationships, leading to decreased self-esteem, anxiety, and eventual relationship breakdown. In many cases, the causal chain is the other way around. Strained relationships can reduce self-esteem, cause anxiety, and thus result in sexual dysfunction. The most common types of sexual dysfunction. Sexual dysfunction in men takes many forms. Erectile dysfunction, often shorthanded as ED, is the difficulty in achieving or maintaining an erection of sufficient strength for effective sexual intercourse. Premature ejaculation is when the discharge of semen occurs sooner than desired during sexual intercourse. Delayed ejaculation is the term to describe the difficulty or inability to ejaculate during sexual intercourse. Low libido, hypoactive sexual desire disorder, is attributed when a person experiences reduced or absent sexual desire. Sexual dysfunction in women takes many forms. Female sexual interest arousal disorder is the label to describe when a lady has low sexual desire, reduced sexual arousal, or difficulty experiencing orgasm. Vaginismus describes the condition of a woman having involuntary spasms of their pelvic floor muscles that interfere with sexual intercourse. Dyspareunia describes a woman experiencing pain during sexual intercourse. What are the causes of sexual dysfunction? A vast number of books and academic articles have sought to answer that very question. Here, in a brief article, we can share only the headline causes and simply don't have enough space to fully explore the known and multifaceted causes. Some physical causes of sexual dysfunction. Health problems and chronic illness, such as diabetes, heart disease, and neurological disorders, can contribute to or directly cause sexual dysfunction. Some medications, including antidepressants, blood pressure drugs, and antihistamines, can have unwelcome side effects which impair sexual function. Hormonal imbalances, such as low testosterone in men and hormonal fluctuations in women, can impede sexual desire and function. Pelvic floor dysfunction. Problems with the pelvic floor muscles, such as weakness or tightness, can contribute to sexual dysfunction in both men and women. Surgery. Pelvic surgeries, such as prostate surgery in men and hysterectomy in women, can damage nerves and blood vessels, leading to sexual dysfunction. Emotional and cognitive causes of sexual dysfunction. Anxiety and stress, performance anxiety, relationship stress, and life stress can substantially impair sexual desire and functioning. Depression can decrease libido and make it difficult to experience sexual desire or pleasure. Negative body image can diminish a person's sexual self-esteem and thus their level of sexual desire and arousal. Past sexual trauma can lead to emotional and physical avoidance of sexual intimacy, or even its prospect. Relationship factors. Poor relationship communication or unresolved relationship conflicts can create tension, stress, and reduced feelings of emotional intimacy and connection, and thus hinder or prevent sexual intimacy. Preventing sexual dysfunction. With the natural fluctuations in our bodily functions, emotional states, and mental focus causing variations in our level of sexual desire and arousal, it is inevitable that almost everyone has episodes of sexual dysfunction. Part of having a healthy mental approach to sexual function is accepting that sexual function varies and no one can have peak sexual function all the time. While complete prevention of sexual dysfunction is, of course, impossible, several healthy lifestyle approaches can help maintain sexual health for as long as is humanly possible and make it as consistent as possible. Here are some of the approaches. Take regular exercise. Regular physical activity can improve overall health, including cardiovascular health, nervous system health, and muscular health, each of which is essential for sexual functioning. A healthy, balanced diet, abundant in fruit and vegetables and whole grains, gives you the diversity of nutrients, vitamins, minerals, etc. that are all necessary to support overall physical, mental, and sexual health. Manage weight. Maintaining a healthy weight improves or prolongs overall health and reduces the risk of several medical conditions, for example, cardiovascular disease, obesity, and diabetes, which can all cause or contribute to sexual dysfunction. Stress management. Practice stress-reducing techniques such as yoga, meditation, and deep breathing exercise. Prioritize looking after you. Make time for activities that you enjoy and those which enhance relaxation and well-being. Open and safe communication. Maintain open and honest communication with your partner about your sexual desires and concerns. Share any challenges you may be experiencing. Create a mutually safe and supportive environment for sexual exploration and intimacy. Addressing sexual dysfunction. Prevention is better than cure. Keep yourself fit and healthy to avoid the health and sexual dysfunction problems that may otherwise emerge. Medical assistance. If you are experiencing sexual dysfunction, consult with a healthcare professional such as a physician or urologist for men and a gynecologist for women to rule out any underlying medical conditions. Be honest about any and all factors that may be involved. Although this may be a highly personal discussion for you, your healthcare professional has heard anything you wish to share many times before, and they can only help you if you are honest with them. If you are spending all night trying to do what you used to be able to do all night, tell them. Other help for sexual dysfunction. Sex therapy can provide couples or individuals with tools and techniques to address their sexual concerns, improve their communication, and enhance their sexual satisfaction. Psychotherapy. Individual or couples therapy can address underlying psychological factors such as anxiety, depression, and relationship issues which may be contributing to sexual dysfunction. In some cases, medications may be prescribed to treat underlying medical conditions or directly address sexual dysfunction. In other cases, medication may be the cause of the problem. Lifestyle changes. Adopt the lifestyle changes such as improving diet, increasing exercise, and managing stress that will make a long-term difference to your health, sexual, mental, and physical. Coping strategies. When sexual dysfunction persists despite the best treatment efforts, in order to protect your mental and emotional health, a change of approach is necessary from seeking cure to adopting effective coping strategies. Here are some. Focus on intimacy. Reshape your perceptions of intimacy. See intimacy as much more than sexual intercourse. Find other ways to express love and affection, such as cuddling, kissing, and deep emotional connection. Develop and maintain fully open and honest communication with your partner about your and their feelings and concerns. Seek to have an in-depth understanding and compassion for each other's challenges. Practice self-compassion and avoid self-blame. Acknowledge that some things about our bodies are beyond our control and that sexual dysfunction is a much more common issue than most people are prepared to admit, and that you are not alone. How common is it? Around 50% of people over 65 experience some form of sexual dysfunction, and the older we become, the higher that percentage. In evolutionary terms, that is exactly as you would expect it to be. Our bodies evolved to maximize our chances of sexual reproduction in our peak years. It makes evolutionary sense for us to be less equipped for sexual function and more equipped for nurturing and support of the next generation as we age. Support groups. If sexual dysfunction is happening to you before your time, it might be worth considering joining a support group for individuals or couples experiencing the same challenge. Sharing experiences with others who understand can be incredibly helpful and reassuring. You may also wish to consider seeking help adjusting to sexual dysfunction from mental health professionals. Here's a takeaway. We all experience sexual dysfunction for a myriad of reasons, and accepting that reality removes self-imposed pressure that can and does impair sexual functioning. If sexual dysfunction is temporary, we can make the health improvements listed above to minimize its occurrence. If our sexual dysfunction is permanent or heading in that direction, we can acknowledge the new reality and find other ways to express love and intimacy.